Things are happening in South Africa. The leadership is...
This speech, a decision that rippled across the globe, particularly for those who relied heavily on USAID, an announcement by President Donald Trump to cut USAID funding to many African countries, South Africa included. Did he know that this move would transform lives, shatter hopes, and alter the very fabric of support for millions? I'm here at SLN Clinic in Johannesburg, a place that once offered hope to those living with HIV. Meet Faith, like many others. She arrived at SLN Clinic unaware of the storm that had just swept through her life and the lives of countless South Africans. As she approached the gate, disbelief washed over her, a harsh reminder that the vital services she depended on have been cut abruptly.
I come here to Eslin to look for my PrEP, to collect my PrEP and BP pills, but I find the clinic is closed already, and I don't have anything to do to go to another clinic to collect PrEP as usual. So now I am struggling. Even my friends, even many people, we are struggling to get our pills.
For Faith and many others, this clinic was more than just a medical facility. It was a lifeline. With South Africa facing one of the world's highest HIV rates, the closure of clinics means that access to critical treatment like antiretroviral medication essential for managing HIV has been stripped away, leaving patients in a limbo of uncertainty.
As we can see now, everything. We don't have money to buy pills because now they are going to sell it. This clinic was helping us, to giving us PrEP, BP, and another stuffs to survive. But now we are struggling.
All around, the reactions mirror Faith's disbelief, a community on the brink of despair. These individuals here, like Faith, have come not only in search of treatment, but in search of hope. Their dependence on the USAID for free medication and support has left them vulnerable, raising questions about the future of their health and well-being.
In terms of ARVs procurement, as a country procuring 90%, only 10% that was complemented through the PEPFAR funding through Global Fund. But that on its own does not sit well with people who are now on treatment, especially those who had been taking their treatment quite religiously, were confirmed virally load suppressed, and now petrified to say, how long will we still have ARVs?
In 2024, South Africa saw a decrease in HIV prevalence, but with more than 200,000 new infections and a significant portion of the population relying on antiretroviral treatment. A cut in aid, particularly from PEPFAR, could lead to a surge in new infections and deaths, especially among marginalized communities, potentially reversing progress made in the HIV response. So, what does this mean for the South African government? What actions must be taken to safeguard the health of its citizens and ensure access to necessary treatment continues? As aid shrinks, the responsibility shifts to local governments, pushing for solutions that many fear may not come fast enough.
All we need is an integration of resources that requires a political will, but at the same time is to ensure that government, through its coffers, the domestic resources, has to be channeled to close that particular gap. That's what needs to happen at this stage.
PEPFAR statistics show that at the end of 2024, it was providing life-saving antiretroviral treatment to nearly 21 million people across 55 countries, many of them in sub-Saharan Africa. The implications of these funding cuts stretch far and wide, challenging not only the health of South Africans, but threatening the resilience of a continent. The quest for solutions, innovation, policies, community support, and international partnership grows urgent in the wake of an evolving crisis. In Johannesburg, for News Central, I am Bongani, Siziba.